Okay, now it looks like we're going to get this thing rolling.
Hello, everybody.
Yeah, so wonderful. Thank you for joining us, Mayor Roth. Mitch, it's going to be hard not to just say Mitch, but Mayor Roth.
You can call me Mitch.
All right, so I'm going to do a very quick introduction and welcome. This is our first, this is the East Hawai'i Coalition, East Hawai'i Coalition to Prevent Child Abuse and Neglect's first webinar, right? So the in the past, we've done a proclamation with the mayor every year. Last year, of course, it got crazy. We didn't get to do that. And I know in the past that Mitch has been tremendously supportive of this group, working beside his office when he was prosecutor, tremendously supportive. So it's great to break him in this year and have him here to join us. And I want to just take a moment to talk a little bit about the coalition. And so everybody, I'm very glad to have everybody join us today. The East Hawai'i Coalition to Prevent Child Abuse and Neglect, wow, I don't know when we started, but it's been around for well over 10 years. And the intent of this coalition is, one, to raise awareness about the challenges facing our children, in particular when it comes to child maltreatment, child neglect, child abuse, and try to build coalitions, build resources in the community so that we can support families in keeping their children safe, right? I mean, the main thing we want is we want the families to have the skills, to have the resources they need to be successful as parents, and so that their children can be successful. And so, they stay out of the system, right? And if they're in this, and if they do end up in the system, then the response is compassionate and supportive as best as possible. And the coalition itself consists of organizations and community groups on the prevention end. So totally prevention services, as well as intervention services, and everything in between. So we have DOE, Catholic Charities, Neighborhood Police of Puna, the prosecutor's office. We have Child Welfare Services, the Children's Justice Center, Child and Family Services. So we have a broad spectrum of agencies at the table, as well as community partners. And so April is Child Abuse and Neglect Awareness Month. And I'm gonna stop filling all the air and hand it on over to Mitch, to Mayor Roth, to do the proclamation and share some of his wisdom with us.
Thank you so much, Paul. It's great to be back talking to this group. As you know, for much of my career, preventing child abuse and domestic violence and has been one of my big passions. And one of the things I always look at is these kids are our future, and the better we do in parenting them, the better we do in working as a community, supporting them, the better these kids will be in their lives, and the better our future will be for the whole county and for everybody else. So I'm very proud to give you guys a proclamation, and I'll just read it for you, since I can't just sit it someplace and you guys can look at it. But the proclamation, here it goes. Whereas whereas child abuse and neglect are ongoing complex problems in our society affecting many children in the county of Hawaii, and whereas our children are vital to our state's future, success, prosperity, and quality of life, as well as being our most valuable assets, and whereas every child is entitled to be treated with aloha, loved, cared for, and nurtured to feel secure, and to be free from verbal, sexual, emotional, and physical abuse and neglect. And whereas it is the responsibility of every individual who comes into contact with a child to protect and malama that child's inalienable right to be safe and a nurturing childhood. And whereas communities that provide social support, knowledge of parenting, child development, and concrete resources essential to cope with stress, ensure children grow to their full potential. And whereas effective child abuse and neglect prevention strategies succeed because of partnerships created among citizens, human services agencies, schools, faith communities, healthcare providers, civic organizations, law enforcement agencies, and the business community. And whereas the County of Hawaii has dedicated individuals and organizations who have partnered with the East Hawai'i Coalition to prevent child abuse and neglect, to counteract child abuse, and by increasing community awareness, maintaining prevention programs, implementing educational programs and activities to strengthen families. Now, therefore, I, Mitchell D. Roth, Mayor of the County of Hawaii, do hereby proclaim the month of April 2021 as Child Abuse and Neglect Prevention Month in the County of Hawaii, and encourage all citizens, community agencies, faith groups, medical facilities, and businesses to increase their participation in our efforts to support our Hawaii Island families, to prevent abuse and neglect, and strengthen the communities in which we live. And it's signed by me, Mitch Roth. So I'll just say that this is what you guys are doing is so important to our future, to creating a safe and healthy community. And I just want to thank all of you for everything that you're doing, because it does make a huge, huge difference. So thank you, everybody.
All right, thank you very much, Mitch. And once again, really appreciate you taking a little time to be with us, and appreciate all your support, and looking forward to working with you over the next couple of years.
I'm looking forward to working with you guys as well. Take care, everybody. Thanks.
Aloha.
Aloha.
Okay, I'm going to do a little housekeeping. So this is a webinar. It's a webinar format, which means that your mics and cameras are off. And if you have questions, because we're going to have a presenter in a moment, you can go ahead and type that into the chat. Other than that, you know where the bathroom is. I don't have to give those instructions, which we would normally do. So, right, nice benefit of this format. So I should have done a little bit more homework when we invited Dawn to do to present for us, but she was recommended to us, highly recommended by one of our coalition members. So I'm going to let her do a little bit of a self-introduction, and we've asked her today to do a short presentation on ACEs. So that's the adverse childhood experiences, super important. So Dawn, if you would go ahead and introduce yourself.
Great, mahalo. As I am doing this and getting into the presentation, is it possible for me to share screen so people can get some of my visual?
Yes, I think that should be possible. Kaikea will work behind the scenes, so see, you can try and did you try to share your screen?
Yeah, go ahead and try it, Dawn, and I can approve it, or Joshane can as well.
It says host disabled participant screen sharing.
So that would be myself or Joshane to amend that. Okay, there we go. Now you're allowed. Go ahead and try now.
Okay. Perfect. Thank you, everyone, for rolling with us as we all figure out this new technology that is the webinar. So mahalo nui to all of you for being here. I'm not going to look at the number on who's here, because that will make me a little bit more nervous, because even as a trainer, public speaking is not my favorite thing, especially since I cannot see all of you, but you can see me, which is a little unnerving, to be completely honest. But so grateful to have all of you here and for the mayor's words and proclamation and commitment to the prevention of child abuse and neglect and the forwarding of understanding of adverse childhood experiences. So as Paul mentioned, I'm Dawn, and I'll get into a little bit about who I am and what I do and what adverse childhood experiences are. So as we begin, again, mahalo to Mayor Roth for his words and this proclamation, and really a really big mahalo to the planning team at the East Hawai'i Coalition to prevent child abuse and neglect for this opportunity to go and speak to all of you. My name is Dawn Rego. I have a master's degree in social work from the University of Hawaii at Manoa and a certificate in conflict resolution from the Matsunaga Institute and a BA in politics and government from the University of Puget Sound. I'm a trauma-informed care trainer and have been trained by Danny Goya of Keala Hoaka and the Community Resilience Initiative. And we are recording this webinar, and I will make a note that some of this information that I am including in my presentation is proprietary to KAHA as well as the Community Resilience Initiative. So we are recording in the spirit of sharing Ike and raising awareness, but please do be respectful about the content that I am sharing, because some of this is not my own content. So I just wanted to make a really brief note about that. I am a training consultant, and I do work in the fields of forwarding community and social justice and uplifting la hui. And I'm super grateful for this opportunity to share this Ike with all of you. And most of all, I am a mom. I'm a wife. I'm a hula learner. I'm a social justice advocate. And I included this picture here of me and my son during his graduation from kindergarten, or not kindergarten, from preschool into kindergarten, because of the olelo no'eau that you all utilize in your flyer and your logo that you have. So hele poina ole ke keiki. So a lei never forgotten is the beloved child. So want to give a mahalo to our kupuna, Tutu Mary Kavena Pukui, for her foresight to go and preserve our treasured and incredibly wise sayings. So it really recognizes the preciousness of our children, that they really are the most important things in our lives. And we're reminded that, like Keikoa's arms around my neck, the most incredible lei that we have is the arms of our children around us. So, and as we look at this image of all of these leis down here at the bottom, we see each individual flower, right? The pua that we call it here in Hawaii. And we honor our keiki by calling them pua. So recognizing their preciousness as well as their potential. And as we look here at the multitude of pua within these leis, we see an aloha, this collective pua of all of the children of Hawaii. And I really want to mahalo Jenna and Kekai for sharing their mana'o around the selection of this olelo no'eau and the application to this work, because this is really foundational to, a really amazing integration of who I am as a hula learner, as well as a trauma-informed care trainer. So as we are all about safety and connection, and as we transition into talking about adverse childhood experiences, I just want to make people aware that this may bring up some feelings and emotions, and we really do try to center all of our trainings on this concept of safety and connection. So I offer this question to all of you. Who are you bringing with you today? And go ahead and please drop that into the chat if you are able and comfortable to go and do so. So it may be somebody literal that you might be sitting next to your coworker in the next cubicle, or maybe your ohana that's next to you, or your keiki who is playing next to you, or maybe it's a kupuna who has passed, who is here with you today. Please go ahead and share that in the chat if you are able and willing to go and do that. And so while I cannot connect with all of you due to the limitations of this amazing technology that we have access to, I really want to just make sure that people take care of yourselves and take care of others. Drink water, move around, take breaks. As Paul mentioned, you know where the bathroom is, and really reach out and connect with somebody also too. I see a couple of comments that are coming in. Oops. Husband and children, my sister, family in our community. Mahalo nui. Please continue to go and include that and drop that mana'o. As we are going through the presentation. So one thing we also think about is that we really are shaped by our experiences. So most of our wiring is really this result of these daily life experiences that we have that are ingrained in our senses. So early experiences are really built into our bodies. And this sets the stage for us to be prepared for life in a dangerous world, as is illustrated in this picture on the left-hand side, if these are the experiences that we know, or in a life that is a safe and nurturing world, like these keiki or who are here on the right-hand side. We are really shaped by our environment, our experiences, as well as our interpretation of the world. So what is trauma? I'm going to read this definition word for word from SAMHSA, that individual trauma results from an event or a series of events or a set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening, with lasting adverse effects on the individual's functions, including mental, physical, social, emotional, or spiritual well-being. And these can potentially be events that are perceived as threatening the life or physical integrity of a child or someone who is important to the child. These may be unexpected events outside of a person's control, say, for example, being a victim of a crime or a car accident or a hurricane or other natural disaster, and is really often associated with this feeling of helplessness or fear. So what are these adverse childhood experiences? I know we tend to use a lot of acronyms in our work. So ACEs, adverse childhood experiences. So these are these really extremely stressful or traumatic events that occur within the first 18 years of life. So they can include emotional, physical, or sexual abuse. They can include neglect, emotional or physical neglect. There's also household challenges that we see around violence, substance abuse, or mental illness in the home, parental separation or divorce, or incarceration of a household member. And these are things that really can undermine a sense of stability for young people and creating safe and nurturing relationships. So I want to briefly chat about the original ACEs study it really was this landmark piece of research that came out of the mid-1990s, was a partnership between the Centers for Disease Control and Kaiser Permanente, and they had over 17,000 people in Southern California. And they did find this association between these incredibly stressful events and experiences early on in life, and the potential for impacts with lifelong health, including the possibility for poor outcomes later on in life that range from, say, increased risk of diabetes to substance abuse, suicide attempts, possible poor learning outcomes, and even earlier deaths. A couple of limitations and just kind of words of to note about this particular study, that it did find a relationship, a correlation, but it does not necessarily predetermine or cause these particular outcomes. It's a correlation study, not a causation study. And ACEs should never be utilized as a diagnostic tool and really must be administered with the proper support as to not to re-traumatize the individual. And within the original ACEs study, the depth of the trauma really was not factored in. So something, say, like an amicable divorce, where one parent was leaving the household, really is considered one ACE, even as, say, you have the sudden death of a parent. Both of those are still both considered one ACE. So, and it does not also take into account things like community trauma or INA trauma or cultural or historical trauma. And there is absolutely a growing interest across the country and here in Hawaii to understand ACEs. So how prevalent are ACEs? Within the original CDC study and Kaiser Permanente study, 64% of adults reported at least one ACE, with 12% reporting 4 or more ACEs. And according to the CDC, with this ongoing research that is being done within at least 23 states, 61% of adults experienced at least one ACE, and nearly 1 in 6 reported 4 or more ACEs. And to bring it a little bit closer to home here in Hawaii, 58% of adults that were included in this study of around 5,000 people back in 2010, at least 58% reported at least one ACE, and 8% reported 5 or more ACEs. So why is this important? Why is it important to go and understand that? Because there are potential impacts later on in life with these adverse childhood experiences. And you'll see a really brief listing here on your screen that can include alcoholism and alcohol abuse, depression, early initiation of smoking, unintended pregnancy, increased ER visits, liver disease, multiple sexual partners. And so we see this connection here within this diagram from the Centers for Disease Control, where this adversity and trauma early on in life can potentially have lasting impacts in all these different ways, from increased injury to issues with mental health, maternal health, infectious disease, chronic disease, risky behaviors, and potential impacts on opportunities later on in life. And it can impact a child's education, their occupation, and income. And additional research has shown that compared to those with no ACEs, children ages 3 to 5 with 2+ ACEs are 4 times more likely to have social and emotional challenges that can impact learning. And students with 3+ ACEs are 2.5 times more likely to go and fail a grade. We're already beginning to go and see how even early on in life, these children, they're not even adults, they're still within the school system. It's already beginning to go and have the potential to go and impact their educational trajectory. And students with 3 or more ACEs are significantly more likely to be unable to perform at grade level, be labeled as special education, suspended, or expelled. But it's really important to remember that we are not these adverse childhood experiences that may happen to us. We are definitely not our ACEs score, and they do not define us. We are not predetermined to have these potential outcomes. We know that there is a connection, a correlation between ACEs, adverse childhood experiences, and these outcomes, but they're definitely not our destiny. And one thing that the Community Resilience Initiative always says is what's predictable is preventable. And much of it really begins with the caregiver response. And a child with high ACEs, with supports, with a caring adult supports, can be less risk than a child with low ACEs and no support. So this idea of safety and connection and caring adults within young people's lives can really make all the difference. That support system is absolutely vital. And I really wanted to briefly touch on a couple of kind of more positive tools, I guess, to say, or strategies in order to go and really kind of counteract and combat the potential impacts of adverse childhood experiences. And one of them is this idea of benevolent childhood experiences. As I mentioned earlier, we're really all shaped by our experiences, and they may be negative, but we can also have these positive experiences that help to show and ingrain and give us these different experiences. So they're really favorable early experiences in life, like healthy attachments, effective parenting behaviors, as well as connection to resources and support. So things like, did you have at least one teacher who cared about you? Did you have at least one good friend? Did you have opportunities to have a good time and enjoy life? Did you have a regular and predictable home routine, like regular meals and regular bedtimes? All of these things can really make an impact and provide consistency within a child's life. And that idea of consistent adult supports and relationships can make all the difference. And also, additionally, really briefly touching on the protective factors framework. This is a study that comes out of the Center for the Study of Social Policy. It's their Strengthening Families initiative. And we know that certain protective factors can really help to mitigate the effects of ACEs. And we work to go and embed these support systems within our day-to-day work, in our home life, and within our professional work. And so we really should do everything that we can in order to keep children safe and connected, and really keep families connected, right? To build family strengths and that family environment that promotes optimal child and youth and family development. So we see here these 5 points that are pillars of their particular program. So looking at parental resilience, that we really can't eliminate the stress of being a parent. And this is very real during these COVID times when kids may still be at home with us for this very prolonged period of time. But we can increase the capacity of resilience and how we deal with stress, say like rest and reset plans, problem solving, and doing the work of trying to go and address parental trauma also too. We also have this second idea of social connections, that friends, family, and community that really provide support to the ohana. And this especially rings true to us here in Hawaii, that ohana and our extended ohana is everything to us. So programming to really create and strengthen these social supports and connections are incredibly critical, and especially reaching out to those families who may be more isolated. And that can mean a host of different things, especially here on Hawaii Island, where isolation could mean like physical distance, or even say like access to things like Wi-Fi and internet and technology connectivity. That can also be a source of isolation also too. The third point being concrete support. So basic needs, food, shelter, safety, and things like crisis programming. Those of us who are in the social service arena are very familiar with the idea of Maslow's hierarchy of needs. The basic needs really need to be met first before we can do the work of learning. So a lot of this is based off of it. We need to meet the basic needs of our families. And knowledge of parenting and child development, and providing accurate information about child development so that it sets the parents up that they have appropriate expectations around what it is that their child can do and should do, and what they can't do, and what's expected for their age group and their behavior. And social and emotional competence for children. So this idea of self-regulation and behaviors and positive interactions with peers, families, and adults. This really can help and bolster and support this idea of formulation of safe, nurturing relationships that is so critical to life's success. And we know and we see the power and potential of people to make a difference in the life of a child. And when we know and understand ACEs and work to prevent them in so many different ways, we also work to go and prevent child abuse and neglect also too. So when we build up this parental resilience, we also build this potential for increased coping strategies, and we build supports not only for the keiki, but also for the whole entire family. And we have this opportunity to move from just being, trauma informed and aware about the presence of trauma to actually being trauma responsive, and where we recognize the presence of potential trauma and ACEs. And we can move away from really reacting to really responding and using less judgment and a lot more love and aloha, and really grounding in this continued idea of safety and connection within all of the work that we do. So in closing, I'd like to return us back to this beautiful Olelo no Eau, Hele Poina Ole Ke Keiki, and the reminder of our kuleana to all of the pua o Hawaii. That is our responsibility to all of the children of Hawaii. I included this lei here, this lei kukui on the left-hand side of the picture. It's made in the hipu'u style, which is this idea of taking the stems and knotting them together. And I noticed the use, and Jenna and Kikai had shared the use of the kukui within your logo. And I've woven it throughout the presentations, the symbol and the icon of the kukui as this symbol of light and enlightenment, right? Because that's what our ancestors used to go and provide light at night. So as we embark on this month of really deepening our awareness of child abuse and neglect and prevention, let us really recognize our kuleana and responsibility to all the keiki of Hawaii. How are we bringing all of these issues to light? How are we bringing light and awareness for others? As each of these kukui leaves within this lei are really, they're knotted together to go and make this lei so that it doesn't fall apart, but yet connected to each other. Let us all really remember our ties and kuleana to each other and to the pua o Hawaii. And I leave you with this final question to all of you, and if you have thoughts and ideas, I welcome you to go and drop them into the chat. But really, how will you, Awomo Kuleana, and assume your responsibility to go and bring about awareness and prevention of ACEs, child abuse and neglect, within your ohana and your community? So again, I invite you to go and drop your thoughts into the chat. I'd love to go and hear them. And because the work just doesn't end by listening to one presentation or just having, attending a workshop or, continuing to attend, it's the continual work that we have to do, not just within this month, but really all year long. So mahalo nui again to the planning team of the East Hawai'i Coalition to prevent child abuse and neglect. Special mahalo to Joy, Paul, and Kaikea, and Joe Shane, and to all of the coalition members for allowing me the opportunity to really briefly share with all of you some information and ike about adverse childhood experiences. Again, really want to mahalo Danny Goya, Kaha, Community Resilience Initiative, Jenna, and Kekai for all of your ike that helped to infuse all of this presentation today. Mahalo nui to all of you who are joining today for all of your work, really critical and important work on behalf of the Pua o Hawaii to raise awareness and do work to prevent child abuse and neglect. So mahalo, everyone.
Thank you, Dawn. That was an amazing presentation. So I'm going to chunter on for a minute and give everybody a chance. If you have questions for Dawn, she is with us for a little bit more. So if you have questions, please put them in the chat. Praise is good too. That was a very nice presentation. And, when I first came across the ACEs, it was simultaneously depressing and affirming, because basically it was data that told us what we already knew, right? That the impact, that the trauma that children experience is real and carries on into their life. That's the depressing part. And the kind of affirming part was, I'm not crazy for believing that. And two, that we collectively can mitigate that. Even if they've been traumatized, we play a significant role in mitigating that harm, right? So we have faith members who are, faith communities who are participating in this, who've joined us today. We have other groups and so forth. And, my hope is that, Dawn has helped us plant this seed, but that this is just one of many presentations, one of many opportunities to reach out to the community to help them understand the reality, the vulnerability of children, and also the very important role that we all play in helping our children heal from past traumas, or even better, avoid being traumatized. So big mahalo to Dawn for such an amazing presentation. It's a very, I would like to direct you, there's not much up there because it's brand new, but we do have a website. So it's the EHCAN, EHCAN .org is our website. You can go there for just a little taste of information. I don't even know if we have a sign up list yet there. Or you can reach out to me or to one of the coalition members. I did in this new format. Dawn covered for me. I appreciate that very much, but I did forget to thank our panelists, our other panelists. So we have Kaikea, who came on initially and is really working behind the scenes, who did the stuff to get the webinar up, who got the webpage up. She's not a panelist, but Jenna from Child and Family Services helped put together a lot of the beautiful graphics and information that's going out. We are doing, this is part of a social media campaign. So please, you can follow Neighborhood Place of Puna, and you can follow, I think CFS, I don't want to speak for them, but the media is going to be going out. So please share the media, please share information about ACEs, about Child Abuse and Neglect Prevention Month through your various social media. Anybody who's ever heard me speak again knows that, I'm very kind of vision, mission driven. And, I believe, very strongly, I deeply believe that as a community, we can end child abuse and neglect, not reduce it. We can end it, but that has to come from our hearts and a change that we make inside of ourselves. Yeah, okay, we got some suggestions for some other stuff going on in the chat.
I see a couple of thoughts and comments, and I think Pearl might be one of the first comments that's on there. Mahalo for the enlightenment you've brought to our program. Is there a website to obtain the ACEs questions for families to ponder? And one of the things that I would really comment about actually administering and just really avoid just, printing it out and like handing it to your families, because really one of the things that the tenets around trauma-informed care and trauma-informed responsiveness is this idea of kuleana and responsibility not to go and minimize as much as possible the re-traumatization of families, because we never truly know our family's full and past histories. But really, if you were to, and I really have caution around administering this, but just make sure that there are proper one-on-one supports that you can do in order to go and support the families in case things start coming up, because there may be trauma that might be uncovered through the administration of the questionnaire that may inadvertently trigger someone into past memories or things like that. So, but one of the things that you can do is really focus on, say, like the benevolent childhood experiences and what are these healthy, supportive things that we are putting in place, and how can we look at this through kind of this strengths-based perspective, right? That all families, no matter what circumstances they're in, has a set of strengths, and that's something that we do the work to go and uncover what those strengths are and really build and bolster and scaffold what those strengths are, and start the work from there. So that's one thought on that. And I think that I saw a couple of other comments. And I love this comment around presentation is a really important reminder that we really can make a difference in a child's life with a smile or a kind word, to holomua with that action. Absolutely. That's really one of the tenets on our training, is kind of this power of one and power of community to go and collectively raise awareness about adverse childhood experiences and the impact of trauma, the impact of cultural and historical trauma within our communities, but also really empowering communities to utilize things that they have and things that they know, these existing relationships and connections that we already have within communities, to be that support either for the child or for the family. So mahalo for that comment. And Dawn, panelists and organizers, mahalo. What is our action plan as a community so we can measure the changes? I think, I know the coalition must be having conversations around what action plans it looks like specifically for within the coalition. But then also, like, you can also think about what this also looks like, say, within your sphere of your individual organization. Like, how do we increase capacity as a trauma-informed organization, or how do we bring more awareness either to trauma strategies or trauma-informed strategies, or the awareness of things like cultural and historical trauma and that impact, potential impact within the families that you serve. And I also am a really big advocate of bringing this also into the community or into the family level also too, because this is where a lot of change happens. happens that we may not necessarily be able to go and measure, but it definitely one family here, another family here that are building and working on and recognize their strengths and their connection and their kuleana to themselves as well as to other families who are around them, I think really can start to not necessarily completely hulihia, but start to change that trajectory slowly by slowly. And I don't know,
Yeah.
I'm taking up and I'm just going through all of these. So if you have comments from Paul or Kaikia or Joshine, please jump in.
No, I saw that one from Charlene trying to light a fire under our, you know what. So yes, we are trying to we do have, as I said earlier, we're going to have more educational events throughout the year. But there are prevention focused organizations right here in East Hawaii. So Neighborhood Place of Puna is one. I see Andy's joined us from the YWCA Healthy Families Program, totally prevention programs. There are other, DOE has prevention programs. There are prevention programs. So one of the things that all of you can do is make your voices heard, that we need more resources in the community. We need more family focused programs to support families and support children. I'm just kind of reading through here.
There was a comment here about the presentation needs to be presented in community. Absolutely, because, and this was just a very quick snapshot that I took out some just really key points to share with all of you, as well as tie in the mo'olelo around the olelo no ayao that you utilized with the lei, because it was such a beautiful analogy. And I think it really helped to go and tie in. And I know somebody had commented about this idea of having like the Western perspective as well as our indigenous perspective here in Hawaii also too. And as a trainer, that's something for me that's really important, because it's important for us to go and recognize that we live here in Hawaii, and so much ike from our kupuna, when we ground in it and we really recognize the brilliance of our ancestors, that they had a lot of the blueprints for health and wellness, that when we center the keiki and recognize the child as this loving lei, right, that how is it that we can still have adverse childhood experiences and child abuse and neglect when that's the philosophy that we come from? So a lot of it is making sure that we do look at this from both lenses, because Western research absolutely is important and it's critical to forwarding this work, but also making sure that we recognize the ike of our kupuna, because there is a lot that we can work off of also too. But I wanted to specifically talk about the getting the workshops out into the community, because last year, at the ending part of last year, which was part of how I had gotten trained, and mahalo to Vibrant Hawaii and the Hawaii Rise Foundation, which was a catalyst for all of this work and getting this into the community through that initiative with funding from the County of Hawaii CARES Act money. We were able to go and train a little over 800 individuals on the island of Hawaii within these three areas that we're training: Trauma-Informed Care 101, ACEs, Adverse Childhood Experiences, and Benevolent Childhood Experiences, and Cultural and Historical Trauma. So the work is definitely there, and we have our work to cut out for us to definitely continue the expansion of these trainings and going wide as well as going deep as to what our impact can potentially be. Absolutely. Mahalo for that comment.
Right. And Charlene's asking about how to measure collective impact, which is a great question. I think that's kind of the next the next goal. We really need to kind of figure that out hard. But there are a lot of people looking at that right now.
I would kako'o that. Absolutely, because we know that we can't do this work alone, right? And that we do have there's strengths in numbers and power in numbers, and a lot of it is around doing the organizing and also eventually measuring what that impact is and making shifts and changes as needed with the strategy also too.
Okay, so I'm gonna go ahead and it's basically 9:49, 9:50. I want to go ahead and wrap this up. Um, okay, you can reach out to myself or Kaikea or other coalition members if you want more information, or you want to set up informational some kind of training at your whatever. We can definitely talk about that. But I really want to just mahalo everybody for joining us this morning. Again, mahalo to Dawn. We kind of short notice, and wow, what a treasure. Thank you very much. And thank you for all of the members of the coalition for all the amazing work you do. Aloha and mahalo.